Okay, so today we'll talk about the rest part of the skeleton. So first we'll talk a little more about the axial skeleton. We started the axial skeleton in last week. We'll talk about the vertebral column, which is a part of the axial skeleton. So this is the vertebral column. We'll talk about that. Then we'll talk about the appendicular skeleton. Appendicular skeleton consists of the upper and lower limb bones. So the bones of the upper and lower limb and the girdles. So in upper extremity you have two pectoral girdles. So this is one pectoral girdle, this is another pectoral girdle, and one pelvic girdle. So this is the pelvic girdle. Okay. So we have two pectoral and one pelvic girdle. And then the bones of the upper limbs and lower limbs. Two upper limbs, two lower limbs. So we'll talk about the girdles and the bones of the upper and lower limbs. We'll see the differences between the male and female bony pelvises. This whole thing is the bony pelvis, which is the pelvic girdle. So first, the girdles. Each pectoral girdle consists of two bones. Anteriorly, the clavicle, and posteriorly, the scapula. So these two bones joined together at acromioclavicular joint between the acromion of the scapula and the clavicle. So these two bones join here at acromioclavicular joint and form the pectoral girdle. So this is one pectoral girdle, this is another pectoral girdle. Pectoral girdle secures the upper limb bones. You see, the pectoral girdle is attached to the axial skeleton. So it holds the upper limb bones to the axial skeleton. Pelvic girdle, we have only one, and pelvic girdle consists of two hip bones or pelvic bones or coxal bones. So same thing, two hip bones, pelvic bones or coxal bones. And the pelvic girdle secures the lower limb bones. Same way, you see the pelvic girdle is attached to the axial skeleton and it secures the lower limb to the axial skeleton. Here you see the pectoral girdle, clavicle anteriorly and scapula posteriorly, and they join at acromioclavicular joint. We'll talk about those two bones, the clavicle and the scapula. Clavicle is a long bone placed horizontally this way. Most of the long bones are this way in your body, and clavicle is also called the collar bone. In female, it is also called a beauty bone because you will see the girls sometimes wear, open shirt that you can see the collar bones, celebrities. So collar bone or beauty bone. This bone has two ends. Sternal end is attached to the sternum. So this is the sternal end, which is round. When you see the bone, make sure you see that round. Acromial end is attached to the acromion of the scapula, and this end is flat. If you touch it, you can feel. Another thing is, in the inferior surface of this bone, there is a tubercle, tiny round bony structure here, tubercle. So superior surface is smooth, inferior surface has a tubercle. Another thing is, if you divide this bone into medial 2/3 and lateral 1/3, medial 2/3 is curved forward. That means like, round forward, convex anteriorly. Lateral 1/3 here, you see, is concave anteriorly. Okay. So that is another information about this bone. Fracture of this bone occurs often. The reason is, if you fall, this bone is slightly anterior than the ribs. You see here, these are the ribs here, but this bone is slightly forward. So when you fall, first the hit you get on the clavicle. That's why the fracture of the clavicle is seen often. Scapula is also known as shoulder blade or shoulder blade bone, and most part of the scapula is flat. It has three borders: superior border, lateral border, and medial border. And in the flat part, you have three fossa: subscapular fossa in the front. So entire front of the flat part is subscapular fossa here. And in the back, you have two other fossas separated by this structure, which is called the spine of the scapula. So very simple. Above the spine, supraspinous fossa; below the spine, infraspinous fossa. So three fossa in the flat part. And entire front or anterior surface is called the subscapular fossa, and in the back you have two separated by the spine. Okay, supraspinous, infraspinous. And in the back, the spine becomes the acromion. So this is the spine that becomes the acromion. And there is another process that sticks out from the lateral angle of the bone, that is called the coracoid process. So acromion is this one, and this is the coracoid process. The word coracoid came from the beak of a bird. Coracoid means the beak of a bird. So you have seen the beak of the bird. It looks like they think anatomists is there. Okay. So those two, and then you have a glenoid cavity here for the head of the humerus. So glenoid cavity gets attached to the head of the humerus to form the shoulder joint. Now there is a problem in the shoulder joint. What is that? You see, the glenoid cavity is shallow. It's not deep socket. It is very shallow like this. So head of the humerus cannot strongly fit in it, and shoulder dislocation occurs very often because of the shallowness of the glenoid cavity. Makes sense? So if you fold the hand and pull strongly, suddenly the head will come off because this is not very deep, the glenoid cavity. So that's why we see the shoulder dislocation that occurs in sports, in football or soccer. We very often see that. Now what you can do, you can put it back, right? If shoulder dislocation occurs, you can just push it and put it back in the glenoid cavity. And that's what the doctors will do. But if you try, then it may cause problem. Right? So don't try that. Okay, so that is the scapula. You see, this is the back of the scapula and those structures. Now, the upper limb. We have two upper limbs. In each upper limb, you have 30 bones. So we'll see what are those bones. In the arm, this is the arm, you have only one bone. That is the humerus, this one. Then in the forearm, you have two bones. Lateral bone, that means towards your thumb side. Remember always, this is anatomical position, right? You know that. So lateral bone is the bone towards your thumb. That is the radius. This is thumb, and this is the ulna, medially. And then in the hand, you have wrist bones. Those are called carpals. 8 carpals. Okay. Then in the palm here, you have 5 metacarpals. 5 metacarpals. And then 14 phalanges. Okay, finger bones. So wrist bones are carpals, 8. Palm bones are metacarpals, 5. And finger bones are phalanges, 14. So those are the bones of your upper limb. First, we'll see the humerus. Humerus is the longest bone of the upper limb, not the body, longest bone of the upper limb. And it has 2 ends and a shaft. Shaft is this part, and upper end and lower end connected by the shaft. Okay. In the upper end, you have a head. This is the head of the humerus, and that fits in the glenoid cavity that I mentioned to form the shoulder joint. Then around the head, you see here, just around the head, this is the anatomical neck. Okay, anatomical neck. And then you have 2 tubercles, kind of round structures, greater and lesser tubercles. Greater is the bigger one, lesser is the smaller one. Okay, and in between those 2 tubercles, you see here, there is a groove. This groove is called the Intertubercular Sulcus. Sulcus means groove, shallow groove. So, why it is called Intertubercular Sulcus? Because it is in between the tubercles, right? Inter means in between the greater and lesser tubercle. Make sense? So, why you have a groove there? Through that intertubercular groove or sulcus, a tendon passes. That is the tendon of biceps brachii muscle. You have the biceps here, you know, this muscle is called the biceps, right? We use that term, biceps. So, the tendon from that muscle passes through that. Then, in the upper end, where it joins the shaft, this is the shaft, this is the upper end, where the upper end joins the shaft, that area is called the surgical neck. So this bone has two necks, anatomical neck around the head and surgical neck here. Why it is called the surgical neck? Because fracture, most of the time fracture of this bone occurs here in the or at the surgical neck. Okay, so that is the upper end. In the shaft there is a rough area that is called the deltoid tuberosity. To feel that, you have to touch the bone. That is very important in anatomy. Every time you will study in the lab, make sure you hold it, touch it, okay, and feel it. That is very important to learn the bones. So rough area in the middle of the shaft, that is called the deltoid tuberosity. Why deltoid? Because we know that this muscle is called the deltoid muscle, and that muscle gets attached to this area like this. Okay. Then if you go to the lower end of the humerus, in the lower end you have two articular structures. Articular means joint structures. One is, you see here, this round structure which is just above the radius or the head of the radius. This round, nice round articular structure, that is called the capitulum, and then you have a rectangular articular structure that fits in the ulna, upper end of the ulna. So that is called the trochlea. So round structure is the capitulum and rectangular is the trochlea. And then you have three fossa. Fossa means depression, like this, sink like depression on the bone. So you have three. One is here. This one is pretty clear. There is one shallow one, very shallow, but you can feel that. And in the back you have a big one. You can see this is a nice fossa here. Okay? So you have three, two in the front and one in the back. The one above the radius, that is called the radial fossa. So very simple. Okay, you see above the capitulum, that's the radial fossa, and then above the trochlea, that's the coronoid fossa. Because you see here what happens, this is called the coronoid process of the ulna, and when you bend your flex your forearm, that coronoid process goes inside. That's why it is called the coronoid fossa. When you bend your forearm, the head of the radius enter into the radial fossa. So that's why it is radial fossa. For the radius, coronoid fossa is for the coronoid process. Okay. And in the back, you see here, this is the big one, olecranon fossa. Why it is called olecranon fossa? Because this part of the ulna is called the olecranon process. So you see this olecranon process, this one, when you just extend your forearm, this olecranon process goes into the olecranon fossa. So this fossa is for the olecranon. So those are three fossa in the lower end and two structures, capitulum and trochlea. So if you know those things, those are the important things of the humerus. Dysfunction of muscles of joint structures in the shoulder joint can be tested in different ways. This is one commonly used test that is called Apley's scratch test. The patient is asked to touch the scapula of the opposite side. You know, this is the scapula. So from above and from below. And if you can reach and scratch the scapula of the opposite side without pain or restriction, that tells that your shoulder joint has a lot of flexibility. Okay, it is working fine. If you can't reach there or the reach is painful or restricted, that tells you you might have problem in the shoulder joint or muscles. dropped shoulder and shoulder dislocation are two different things. I have already mentioned the shoulder dislocation. The glenoid cavity is shallow, head of the humerus can easily come up, right? Because of the shallowness of the glenoid cavity. Makes sense? Cannot hold it strongly. So that is shoulder dislocation. Head of the humerus comes up. But drop shoulder occurs due to the dislocation of the acromioclavicular joint here. And what happens if dislocation occurs, separation occurs here, then the shoulder drops down, because you know that clavicle is holding the scapula here. So the scapula will move down, and when the scapula moves down, whole shoulder will look like has dropped. Make sense? Has moved down. So one side of the shoulder will be down, then the other normal side. That is the dropped shoulder due to this joint. And another thing I have already explained, that fracture occurs in humerus usually at the surgical neck of the humerus. So that's the common location for the fracture of the humerus. So those are three clinical situations or conditions. Bones of the forearm. In your forearm, you have two bones, radius laterally and ulnar medial. The shaft of the radius and ulna are connected by interosseous membrane. Inter means in between, osseous means bone. So interosseous membrane, connective tissue membrane that attaches the shafts of those two bones, interosseous membrane. And upper ends of those two bones are attached at the proximal radio-ulnar joint. This is definitely the proximal end, and this is the distal end. You know that proximal means towards the trunk. So proximal radio-ulnar joint and distal radio-ulnar joint. So that's how those two bones are attached to each other by two joints and the interosseous membrane. First, we'll see the parts of a radius. In the upper end of the radius, you have a nice round disc-shaped head. Okay, round but disc-shaped head. So you can put a CD or DVD on it. Okay, it's like flat upper surface, round. And then below the head, you have a neck, and then the radial tuberosity here, that rough round structure. So head, neck, radial tuberosity. Okay, and in the lower end, you see here little bit part that extends further down. Only that part goes further downwards, and that extended downward part is called the styloid process of the radius. Styloid process of the radius. Same thing you have here. That is the styloid process of the ulna. Little bit downwards, extended downwards. Okay. So styloid process of the radius, styloid process of the ulna. Upper end of the ulna is very nice. It looks like an open mouth of a snake. You have seen snake, open mouth. Okay, so like this. So if you see the upper end is like this, that's the ulna. Now, this open mouth, this curved or U-shaped area is called the trochlear notch. Why? Because you know this is the trochlea, the rectangular structure the lower end of the humerus, that trochlea goes in like this. So that's why this is called the trochlear notch. So if you just connect, it makes it easy. Why it is trochlear notch? Because notch means U-shaped area in the bone and trochlea goes in. That's why this is the trochlear notch. Now, the upper jaw, if it is an open mouth, this is the upper jaw, this is the lower jaw. This is the olecranon, that one. That goes into the olecranon fossa. You remember I said olecranon. And the lower jaw, that is the coronoid. So this is the coronoid. It goes into the coronoid fossa when you bend your forearm. So olecranon and coronoid fossa, and this is the trochlear notch. So that's the upper end of the ulna. Here you can see the front and back. So you can see the coronoid process, and in the back you see the olecranon process. Okay, olecranon process goes into the olecranon fossa when you extend your forearm. Carpals. There are 8 carpal or wrist bones. Those are small cube-shaped bones, short bones. They form 2 rows. So here you see these are the carpals, and they form 2 rows, proximal and distal. So in each row you have 4, so 2 rows. What are the bones of proximal row? Scaphoid, lunate, triquetrum and pisiform. Distal row bones are trapezium, trapezoid, capitate and hamate. If you don't want, you don't need to remember all those 8 names. Just know that there are 8 short carpal bones. They form 2 rows, and among those 8, 2 are important because those 2 bones articulate with the lower end of the ulna. So this is the lower end of the ulna, and 2 of those 8 carpal bones, they articulate with the lower end of the ulna to form the wrist joint here. So what are those 2? Scaphoid and lunate. Okay. So I may ask you, which 2 form the wrist joint? Metacarpals. There are 5 metacarpals. Those are in the palm, and we count number 1 from the one below the thumb. So 1, 2, 3, 4, 5. Okay, and then we have phalanges, the finger bones. In each of these 4 fingers, except the thumb, we have 3 in each of these 4. Make sense? So there are 12, 3 in each, and in the thumb you have 2, so total 14. Now in these 4 fingers you have 3 in each, right? So we can divide those into proximal, middle and distal phalanges. Proximal, middle and distal. In thumb you only have proximal and distal. There is no middle. Pelvic girdle. This is the pelvic girdle, and it is formed by 2 hip bones or pelvic bones, and they secure the lower limbs or lower limb bones by attaching them to the axial skeleton. Now you see that this is the place where 2 hip bones join together, pubic symphysis. So pubic symphysis is the joint of two hip bones. Okay, and if you see the hip bone or pelvic bone, the pelvic bones join together anteriorly at pubic symphysis, which is formed by a fibrocartilage, that piece of cartilage that holds those two bones, that is a fibrocartilage. And in the back, the hip bones are attached to the sacrum at sacroiliac joint, because the upper part of the hip bone is called the iliac. That's why that joint is called sacroiliac joint, sacrum and ilium of the hip. Okay. Hip bone or pelvic bone, also called coxal bone, has three parts: ilium, ischium, and pubis. Ilium is the entire top part, the upper part. Whole upper part is called the ilium, and lower back part is called the ischium, and the lower front part is called the pubis. Now, those three parts are formed separately from 3 points. When this bone is formed in very early stage of life, 3 pieces arise from 3 points, ossification centers, and then move towards each other and join or fuse inside the acetabulum. So you can see those 3 colors meet inside the socket, bony socket, that's the acetabulum. So those are 3 parts. Now we'll see the ilium, the upper portion. The top border of the ilium is called the iliac crest. You know, crest, we use the term crest to indicate the top part, right? Crest of the mountain. We see from far, crest of the mountain. That means the top part. So that's the iliac crest. And in the front, you have 2 spines, not very sharp, but kind of pointed: anterior superior, anterior inferior. Iliac spine, spine of the ilium. So anterior means front and superior means above. So in the front, you have upper and lower one, anterior superior and anterior inferior. In the back, you also have 2, posterior superior and posterior inferior iliac spine. So the ilium has 4 iliac spines and 1 crest. Now, if you see the ischium, ischium has a rough, round structure. That's the main part of the ischium, and that is called ischial tuberosity. You see, kind of rough and round. So that's the ischial tuberosity. When you sit on that, using that. Then there is a spine in the ischium, that is called the ischial spine. That's the pointed structure. Okay, ischial spine and tuberosity. So 1 spine, 1 tuberosity. Spine is pointed, tuberosity is rough, round. Then if you see the pubis, pubis part joins the another pubis of the other hip bone at pubic symphysis. So this is pubic symphysis, so this is the pubis. 2 pubis join at pubic symphysis. other couple of structures you need to know is in the back you have two notches, U-shaped, notch U-shaped area I mentioned before. One is the greater sciatic notch, another is the lesser sciatic notch. Greater is the big one, lesser is the smaller one. So greater and lesser sciatic notches. And in the lower part of the hip bone, you have a large opening that is called the Obturator Foramen. Obturator Foramen. It's a big opening. Why you have the greater lesser sciatic notches and Obturator Foramen? There must be a reason, right? You know that many blood vessels, some of those are big, and nerves like sciatic nerve, it's a big thick nerve, right? Those blood vessels and nerves should go to the thigh, lower limb. So from here they pass through the obturator foramen or through the greater sciatic notch. So get out this way to enter into the thigh, or that way to enter into the thigh. So that's why you have those openings. Okay, so that's the hip bone, and the acetabulum is for the head of the humerus, head of the femur, to form the hip joint. That acetabulum is not shallow; it is very deep. It's not like glenoid cavity. This one is shallow, but acetabulum is very deep. So head of the femur very strongly fits in it. Okay, so hip joint is very strong joint in your body. Will not come. The head will not come up. Comparison of male and female pelvis. This whole thing is called the bony pelvis. So you have two hip bones and the sacrum here. They join together. Now, if you see the bony pelvis of a male and a female, they look different, and by looking at the bony pelvis you can tell this is a male skeleton or a female skeleton. How they are different? The easiest way to determine male or female is this angle below the pubic symphysis. You see the arch. This is called the pubic arch. So in female the angle is bigger, wider, and in male it is narrow. So if you see below the pubic symphysis, this angle is much wider in female, narrower in male. So that is one thing. You see the picture in the bottom, female pubic arch and male pubic arch. Another is the pelvic brim. Pelvic brim is this opening here. You see, if you just draw a line like this, this is the pelvic brim. Pelvic brim is much wider in female, but smaller in male. The reason is, you know that inside the uterus here, the embryo becomes fetus, big. So in female, you need more space. And this is the outlet, pelvic outlet. Outlet is also more open in female. For the childbirth, you know that childbirth occurs from female body, so needs more space. So the outlet is bigger in female. Make sense? So pelvic brim is wider as well as the pelvic outlet is wider in female. Another thing is the sacrum. In male, the sacrum and coccyx, those are more forward, inwards, like this. In female, more backwards or outwards. So that also creates more space here. Even though the sacrum is more backwards in female, coccyx are more backwards, during childbirth sometimes the force or pressure is so high that can even break the coccyx or tip of the sacrum. So it could be sometimes dangerous. Okay, so that's how you can separate a male and female skeleton. A few days ago, library, I got a phone call from the library and they said, can you come down, if you have time, we got something urgent. I said, what? Then I went down and they ordered 2 skeletons, one male, one female, and they were very excited to see. Okay, so they took off the cover and they then couldn't figure out which cover will go to what. One was male level, another female, but they couldn't figure out which one. If you know, it is very easy, right? You can I can look from far and tell that is male, that is female, that is male. You see, there are 2 sets of bony pelvis is there. Female is more wider and male is narrow, right? So it's not difficult, you can easily tell, but if you don't know, it is very difficult, right? If you don't know the answer in your exam, then it becomes very difficult. Even if you wait 50 minutes, will not solve the problem. If you know, you can just quickly write it, right? So that is very important, knowing. Okay, so that's the pelvic girdle or bony pelvis. Now the bones of the lower limb. The bone in the thigh is the femur. That's the only bone in the thigh, and that's the longest, largest and the strongest bone of the body. Femur has an upper end, a lower end and a shaft. First we'll see the upper end. Upper end of the femur has a nice round head that goes to the acetabulum to form the hip joint. Then you have a long neck of the femur, and after the neck you have 2 large round structures in the upper end. One is called the greater trochanter, the bigger one, and another is the lesser trochanter. Here you see, this is the greater trochanter, this smaller one is the lesser trochanter. So you have 2 trochanters, head, neck and 2 trochanters. 2 trochanters are connected by a line in the front that is called Intertrochanteric Line. Inter means in between the trochanters. In the back you have a crest, like elevated bony structure, more prominent, not like a line, it's more prominent, and that is called intertrochanteric crest. So you see here, first picture is the front view and the second one is the back. So in the front you have the line, in the back you have the crest. So that's the upper end. In the lower end you have 2 large round articular structure. Articular means again joint. So 2 large articular structures in the lower end. So you see here, this is one, this is another. They form joint, knee joint. So these are condyles, and above the condyle you have small round structure, that is the epicondyle. So you have lateral, this is the lateral condyle, medial condyle, okay, and then you have 2 epicondyles above the condyle. Those are smaller. It's like, sometime when you walk with your small child, after a while your child says, I'm tired, I can't walk anymore. So what you will do? You will take him on your shoulder, right? Okay, come and sit on my shoulder, then you will walk. So you are a condyle and your child is what? Epicondyle, sitting on the condyle. So if this is the condyle, the whole thing is the condyle, this is epicondyle. Make sense? Kind of like a small thing sitting on it. So that's the lower end, and in the front of the lower end you have a smooth surface, that is the patellar surface for the kneecap or patella. That's why it is called the patellar surface. And in the back, in between those two condyles, you have a fossa, very clear, big fossa. That is called intercondylar fossa. Inter means in between the condyles. Okay, in the shaft, you have a line. Clearly you can see that line, that is the linea aspera. Linea means line. And that linea aspera splits into two lines in the lower part of the shaft. Those are called supracondylar lines because those are above the condyles. They go all the way down to above the condyles. So supra means above condylar lines. Another thing, although they did not point to that structure, a tiny hole you can see here is present in the middle of the shaft. That is called nutrient foramen. Nutrient foramen. And nutrient foramen is for the nutrient artery. Nutrient artery enters into the bone through the nutrient foramen. Okay. So those are the things you see in a femur. The bones of the leg. In anatomy, leg means the lower part, thigh is the upper part. Don't, okay, so when you will talk, don't indicate leg, the whole thing. Upper portion is the thigh, lower portion only is the leg. In the leg, same thing here. This is arm, this is forearm, right? Arm and forearm. So in the leg, you have two bones. One is bigger and stronger, another is smaller and weaker. The stronger one is the tibia. And tibia forms the knee joint, not the fibula. Tibia articulates with the femur and forms the knee joint. Fibula doesn't participate in knee joint formation. Anyway, so the medial one is the bigger one, tibia, and lateral one is the smaller one, fibula. Since tibia is attached to the femur, tibia receives the body weight from the femur and transmits the body weight to the foot. Fibula does what? Fibula supports the leg bones. So most of the leg bones are supported by the fibula. So transmitting weight is the function of the tibia, and supporting the leg muscles is the function of the fibula. They are connected like radius and ulna. You see here, the shafts are connected by interosseous membrane, and the upper ends and lower ends are also attached by proximal and distal tibio-fibular joint. In case of the forearm, you saw proximal radioulnar, distal radioulnar, and interosseous. Here, very similar way, tibia and fibula are attached to each other. It's very difficult to separate them because interosseous membrane is a very strong connective tissue structure. Okay. Now, if you see the upper end of the tibia, in the upper end of the tibia, you have two condyles. So now you got two condyles in the lower end of the femur and two condyles in the upper end of tibia. So these two condyles articulate with these two condyles to form the knee joint. In the front of the upper end, you have a rough area that is called tibial tuberosity. So you can actually feel, if you just touch below the kneecap, you can feel that kind of slightly, elevated bony structure. That's the tibial tuberosity. And tibial tuberosity is for the attachment of the patellar ligament. That ligament is very important. We use that ligament to see the knee jerk or knee reflex. We hit or tap on that ligament, okay? And if your leg kicks forward, that means you have that reflex, knee jerk. So tibial tuberosity is for the patellar ligament. So that's the upper end. In the lower end, you have a small extended bony structure that goes further down, like your radius and ulna. And in your fibula also you have extended lower end, and those are called malleolus. In case of radius and ulnar, exactly same structures, those are called styloid process, and in case of your leg bones, those are called malleolus. So structurally they are same. A tiny part goes beyond the lower end. Okay. Medial malleolus in tibia, because tibia is the medial bone, and lateral malleolus in fibula. The medial malleolus you can feel if you touch the side of the medial side of the ankle. You can feel this. This is the medial malleolus of the tibia. Okay, so that's the leg bones. Tarsals, the bones of your foot. There are tarsals, metatarsals, phalanges. In your hand, you have carpal, metacarpal, phalanges. In your foot, you have tarsal, metatarsal, phalanges. Very similar. In the hand, how many tarsal carpals you have? 8. You remember? 4 in each row, so total 8. But in your foot, each foot, you have 7 tarsals, so 1 less. 7 tarsals. You have 5 metatarsals, like your hand, and we count number 1, 2, 3, 4, 5 from big toe side. From big toe side, we start counting. And then you have 14 phalanges, 3 in each of the toes except the big toe. Big toe has only 2, like your thumb. Okay, your thumb has 2, your big toe has 2. Other fingers or toes have 3 in each, so 4. Okay. Here you see 7 tarsals, 5 metatarsals, and 14 phalanges. Phalanges are divided into 3 rows: proximal, middle, distal, like your fingers. But in your big toe, you have only 2 phalanges, proximal and distal. Tarsal bones form the about half part of your foot. posterior half. So tarsal bones are 7 in number, and the largest one is called the calcaneus. Calcaneus is the heel bone that forms the heel of the foot, and that's the largest one. Second larger one is the talus. Upper surface of the talus is very smooth. If you see the picture, you can also tell it is very shiny, smooth. Why? That part forms joint. The lower end of tibia articulates there, and we know that tibia transmits the body weight. So body weight is given to the talus first, then goes to the heel bone, calcaneus, and to the ground. Some weight goes towards the phalanges. That means most of the weight goes to the ground through the calcaneus or heel, but also some weight goes anteriorly towards the phalanx or phalanges. Okay, so those are the bones of your foot. Sometimes you know that particularly the girls, they like high heel shoes. Okay? That could be bad, because we know that your foot is like this. Most of the weight should go to the ground through the heel bone, right? Calcaneus. Now when you push the heel bone up like this, a lot of weight will go this way, yes? And that will cause the friction of between the bones. Okay? Prolonged use may cause inflammation in the joints. Particularly if your body weight is too much, okay, that could be a problem. Okay, so those are the bones of your upper and lower limbs, upper and lower extremities, appendicular bones. Okay.
Do we need to memorize the bones in the feet, or is that like the hand or?
Those I have mentioned, the first one and second one particularly.